So good morning. Well, for us, it's good morning here in Brazil. I am from Federal University of São Paulo, and we have an acupuncture and TCM service at this hospital since it was founded by Professor Yamamura, that was my father, in 1992. So what I am bringing for you today is the craniometric points and nasal bone acupuncture of the Yamamura acupuncture microsystems in an urgent care situation. Okay, we have an ambulatory that we attend many patients, and also we have like an urgent care setting that we receive patients to treat only with acupuncture here in Brazil. So let me tell you a little bit of the history of these all these things that I'm going to say today. Sorry for that. It's very cold here in Brazil right now. So here in Brazil, we have a public health system called Brazilian Unified Health System. It's called SUS. And the approach or the main concern of it is the universal access to the public health system for everyone without discrimination. So you don't have to be actually a Brazilian citizen to benefit from our public health system. And we have, in this model, we have like almost 38 years of existence. 78% of Brazilian population depends and relies on that, especially because we are, losing financial, money, and people are becoming poorer. And then, so they are starting to use this public health system, and we don't actually have to pay anything. Even if you don't pay any taxes, you can, use the system. And we are about 190 million users, and 2.8 billion interventions are made per year, including all medical specialties. And we have in Brazil since 2000 and something, we have a national policy on integrative and complementary practice in the unified health system. It's called PICS, and it included 29 integrative and complementary health practices. And it's present in all of 54% of the cities and across the 27 states of Brazil, included in federal district. Okay. And we have like 10 million procedures with integrative health for 9 million people. Okay, so as I said, we have 29 practices. It includes all of these. I am going to show another slide about the practices and the procedures, and it can be individual and also in group sessions, okay? Especially in the primary care. So we can divide all these 29 health practices, complementary practices, in some of these topics. And according to the medical systems or medical rationalities or traditional medicine, as WHO like to call it, we have traditional Chinese medicine. And here in Brazil, traditional Chinese medicine is almost equal as acupuncture. And we have also Ayurveda, that is the Indian medicine, or homeopathy, and also anthroposophy. But we also have like this natural therapy, body-mind practices, mental therapies, and expression or expressive and mental therapies, natural products like herbal medicine, floral therapy, and this, like ozone therapy, comes into this, the other topic. But we have also Shantala, reflexology, etc. So when the Ministry of Health, also with WHO, our local WHO, started, they created this, they inserted 29 complementary practices. And then the government actually said, okay, in which one are we going to invest firstly or the most? And so then we started providing and conducting and producing map of evidences in all these complementary approaches, practices, interventions, in order for the government to decide if they are going to invest in the where they have the most solid scientific evidence, of course. And traditional Chinese medicine, especially acupuncture, has the most solid, evidence. Okay, so that's why TCM here in Brazil and acupuncture is in the highest level of evidence. So I participate in a group that is called CABZIN, that is academic consortium of integrative health, and we produce maps of evidence in auriculotherapy, acupuncture, cupping, ozone therapy, aromatherapy, etc. Okay, and it's very interesting. This is works together with WHO, and WHO actually is very decided, to help all these their countries, affiliate countries, to insert complementary medicine in their health system. Okay, so about our TCM and acupuncture, etc., we have like 1 million interventions in 1 year only with acupuncture, and another 1 million auriculotherapy sessions during 1 year. Okay, in Brazil, only doctors used to be allowed to perform acupuncture. Actually, it's a medical specialty, but in February of this year, the government signed a law that regulates the profession of acupuncturists. So all the health professions can do acupuncture, can be acupuncturists according to their council, okay, and each one has their own rules. It stays the same for us, medical doctors, and it has been allowed a graduation. It's like almost university level, but it's an incognita actually. On acupuncture. So we are dealing with this right now. And also we started with the Medical Council Federation, okay, that protects not only doctors, but also the patients, because it's going to, to combat, well, we are going to fight actually the patient security, okay? So in this level, in our public health system, we have 3 levels, and of course you also have. And especially in primary health care, acupuncture is well inserted. Actually, the complementary national policy inserted these whole procedures in the primary health care. So all of the complementary interventions are made in the primary care situation, and they are responsible for 78% of the procedures. But we also have the second level, or the secondary care, with medium complexity patients. It's specialized care. So when you rule to the specialists like orthopedic, pediatrician, gynecologist, and also acupuncturist, right? You are in the patient is on the secondary care, and there we perform like 18% of the complementary procedures, okay? And in the tertiary care, this is now we are building here in Brazil that only 4% of the complementary procedures are made inside the hospitals in patients, okay? And of course, acupuncture are in all of these 3 levels. In our service, in our university, we are also in these 3 levels, and I will show this. So we have an emergency and urgent care setting, as I told you before, that we can receive anyone that is passing by the street, and okay, I have a pain and I want to do acupuncture. They can enter, they can be attended in our service. It's like an emergency room. And of course, as Thomas was saying, we are going to deal with the acute complaint, okay? And even though you are receiving the patient in your own clinic, you have to deal with something that made him, made an appointment with you, okay? So every time, actually, we have to deal with some acute crisis, acute pain, and this for the patient is very is very well received, actually, because, as Thomas said, the patient realizes that, okay, someone understands me, and acupuncture and TCM does do this very well. And when you relieve, you give the patient a pain relief. You just are going to have a fan of acupuncture for their own or whole life, okay? And we also, this is not the subject today, but we also perform acupuncture inside the hospital, okay? And for that, microsystems actually are very useful, because not always we are going to have available all the parts of the patient, especially when we go in the ICU, in the intensive care unit. We are not going to have all the points, all the areas that we should perform, acupuncture. Instead, the needles, they are not available. Okay, so we have acupuncture inserted in the public health system since 1988. It's almost when this public health system was founded, actually. And this was inserted also by Professor Yamamura, and also Fernando Gensho, that is, he was a past president of our Brazilian Medical Society of Acupuncture. And so in the first place, we had actually to prove for the hospital, for the system, for the government, that acupuncture should be, it was a good deal to insert acupuncture in the public health system. So the question was, does it really work? And now we are dealing with, how does it work? Okay, so this was, first thing. There has never been, and still nowadays, only our emergency room or urgent care with acupuncture exists in the whole country. So now we are dealing, and we are, convincing, all the public health managers that they should insert or create this urgent care setting with acupuncture, okay? So this emergency setting or urgent care situation with acupuncture, it was founded, we started doing that in 1994. So we have like almost 30 years of experience. And we receive a lot of complaints of the patients, especially the musculoskeletal pain, of course, emotional conditions or crisis, but we receive like asthma, dizziness, tinnitus, and we receive a lot of things. And of course, since we are MDs, we have to see if, first of all, acupuncture is the best intervention for them. Sometimes we receive patients with a life-threatening situation, then we have to tell them to go to the emergency room. Actually, we do this, okay? We call an ambulance, and then we go to the emergency room, the conventional emergency room. And that's why also we have to be doctors, to have a diagnosis, because not always acupuncture or any TCM or any complementary intervention is going to be, the solution for that moment of the patient. So this is an old study, actually, it's from 2019, that we described a semester of our, one semester of our service. And we analyzed, actually, we described the patients according to male or female, the average of age, and also the score of the pain scale, okay? And we can see this. So we have like 7,647 visits although we attend in the ambulatory, this is only for the emergency room, okay? 78% of them were female, and the mean age, sorry, was like 60 years. So we have also, this is a characteristic of our public health system, that I am not calling the 60 who is in the 60s of elderly, okay? But we have like since 18 years until, 90, 93, 95 years old that comes to our service. And we also have the children, but they are not inserted in this paper. So of course, low back pain is the most, common complaint. And when you evaluate the pain score before acupuncture, the mean score was 6, and after acupuncture with one procedure, one intervention, it was decreased to 1. Okay, 22% reported 100% improvement, so the pain was gone at all, and 72% reported more than 50% improvement. And we have also to consider that we have the demand of the chronic pain, is for everyone, every medical specialty. So we are dealing not only with acute crisis, but also with chronic pain, right? And the patient actually, when you ask him, did improve or not, they actually, they don't do like, I go to the service for shoulder pain, but they are not going to give the score only about the shoulder pain, but they're going to be, sometimes they have fibromyalgia, and also they have arthrosis and lower pain. So they, they consider all of it, but they should consider actually the only the shoulder pain that was the motive or the reason for going to the service. But we know also that if you use, especially in the urgent care, like as Thomas said before, like a single needle situation, okay? Microsystems are very, very effective and increases the results. So in this next slide, we also use wrist and ankle puncture, we use Yamamoto, and we also use Yamamura. We have our own, the Japanese technique. And the beauty of TCM and acupuncture is that actually the techniques are very democratic. You can use system acupuncture, also microsystems. So actually, we have to know it all. So that's why we go to the congresses and to courses and etc. So microsystems, actually, the concept of microsystems is very interesting, because it's like a mirror image, right? It's related to somatotopic correspondence. So every microsystem is going to have like a map of correspondence of the areas of the body, like, auriculotherapy, like wrist and ankle, like also Yamamoto, Sujok, the Korean microsystem, etc. So what we know that microsystems, especially I can say, of course, about the Yamamura microsystem, that is related to the Jing, okay, especially in this large bone or long bone microsystem, okay, that we are not going to talk today. But anyway, the conclusion of this paper, and we are updating it until actually this semester, it may reduce self-medication. That is a whole wide world problem that we know about the painkillers. And also it's a very fast, focused, or it's very, direct. So actually what we learn about using microsystems is that the effect or the result of acupuncture is immediate. Okay, you don't actually have to have the patient like laying down, or to wait like 15 to 20, 50 minutes or an hour. This is good when you are dealing with, an ambulatory session, when he goes to your private, office and etc. And also you can relax and you can, work with another issues rather than the acute crisis of pain or anything. Okay, so past this 32 years of experience, we know that when you insert a needle, especially with when using microsystems, you can expect the effect right now. Okay, so if you don't have the 100% effect that you want, you have, rather than just do like an adjustment of the area or the point, the location of the needle, but sometimes you have to do that, or you have to re-evaluate all your the way that you think to check about your diagnosis. So in order actually to have like a fast or rapid analgesia, that is the main concern of the urgent care situation, right? Acupuncture emergency room. In order to have this quick response that we were talking about, you have to have the precise diagnosis. So even though microsystems actually, and that's what we are doing right now in Brazil, that we are teaching doctors from another specialties, especially the ones that they are in family care, so in the primary care, right? We are capacitating, instructing them with some of the microsystems like auriculotherapy that other health professionals can do also, but not with needles. Yamamura microsystem, recent ankle also. And Yamamoto actually is, they learn, but they find that a bit difficult, actually, okay? And there's another initiative that teaches for the doctors in the primary care. It's like a protocol. Okay, if you have lumbalgia or low back pain, you just use like a bladder 62 or HOSI, that is large in small intestine 3, etc. But since they don't understand very well, they tend to to leave it. Okay, unfortunately. So that's why microsystems, when you have the map and the correspondence, it's very useful and very easy, to assimilate by the ones that are conventional doctors. And also, this minimal number of needles. Professor Yamamura said something that I think Constantina mentioned, that, or Thomas David mentioned, that it's not the best, it's not been the best, but the highest level of acupuncturists just use a minimum number of needles. Although we know that, in China, in Taiwan, in Korea, and also Japan, some schools, they tend to use more and more needles. You can see all the videos in the internet, in TikTok and Instagram, etc. But unfortunately, in our country, in our service, this using this minimum number of needles, actually, Professor Isao thought us to use only one, right? It was, like an internal joke. But, this actually was because we have like, we just received like a box with 1,000 needles and it should last like a month, because public health system in Brazil are very poor, lack of money, and of course they are not going to, privilege buying acupuncture needle instead of, I don't know, medication and all the other things. So actually we had to manage. So if I use like 5, 10, 15, 20 needles, that is, adequate in the systemic acupuncture, I wouldn't have, by the end of the day, the another more needles to use it. Do I have the time, Constantina? Is it?
Yes, you're okay.
Okay. Mhm. So about the strategies that we can, talk about in a workshop or something else, we make our integrated diagnosis using divergent meridians, extraordinary vessels, and main meridians. Okay, this is like Asanta is heaven, earth, and man. Three situations, three references. And as I said before, especially in the emergency care, we use a lot of microsystems. Okay, but also, as Thomas said, even in our ambulatory sessions, we start with microsystems, and then we, deal with the TCM syndromes. Okay. So sorry, it was after this photo, it was all the Yamamura system microsystems, related, but microsystems have actually the power to deliver this result. This is a very common situation, like a middle-aged woman comes with the restriction of or shoulder pain or arthrosis or tendinitis, etc. And actually, the orthopedicians, they don't like to operate. They don't want surgery for them because they know that the result is limited. Many of them have like a consequence, the frozen shoulder, for instance. And we actually don't have any medication, any anti-inflammatory, any painkiller that could, bring this result, immediate result for us. So, and acupuncture can do this for us. So, like having lumbar pain, low back pain, sorry, and then have the restriction, limitation of the movement, of the flexion, right? And with one needle, we can do that. Okay, so we have many strategies, many techniques that we can use. So I want to show a video that she has also a limitation. She comes with, the face with it's a painful. She shows pain in her face, right? So this is another technique. Professor Yamamura is palpating, the lung. The large intestine meridian. Oh, sorry, the lung meridian. And then with one needle, oh no, sorry, it was the large intestine meridian. And then with one needle, as you saw it, you can see the result. So this is acupuncture, actually, and you should expect this result. So, of course, this patient probably have or has or had, I don't know, like tendinitis, arthrosis, or etc. But you can deal with the relief of the pain, and also to restore the movement. Okay, limited by the limitation imposed by what she had. Okay, so we have many microsystems to provide analgesia, and we're going to talk about these two today. So when we use craniometric points that Professor Yamamura described, we are talking about 5 craniometric points. Okay, and I'm showing you today 2 of them that we use a lot. That is Bregma point and Lambda point. Okay, all of them actually, and it's not by random that we have 5, and it's related to the 5, also 5 movements or 5 elements or 5 correspondence. Okay, but actually the Bregma point, it allows us to have, to access the anterior region of the cingulus that is related to emotions, right? So actually, when you insert a needle at Bregma point, you should, how can I say, you should direct, okay, to the chin, and we're going to, okay. So the indication of the Bregma point is for acute and emotional pain or situations, right? And this is how you can find Bregma point, because it activates or it modulates the anterior part of the singulos, gyros. I don't know how to say in English, sorry. So whenever you have, an issue that you should use divergent meridians, you can use that, like systemic acupuncture, or you can just put it. This is like a microsystem. It substitutes, okay, all the others divergent meridians in one point. So this is very useful. And if, like we have, all this experience in attending people, when you ask the patients, okay, is the pain came or appeared after, I don't know, some fight, or are you dealing with something stressful, something related to, emotional situations, etc. And of course, everybody does. And emotional part of the life or emotional area of the patient, we should interrogate more. I am a fan of what Constantina always brings to us, that is, modulating emotions and about stress and about, lifestyle, because we just want to treat the pain, and it's not enough. Actually, we have to see, the whole picture, right? This is an example. Okay, she had like fibromyalgia, multiple musculoskeletal pain, insomnia. The sleep was non-restoreful, precordialgia, shoulder pain, neck pain, low back. So this is the combo that we used to say. Okay, this is very common, and it's related to emotions. Okay, and of course we have to, that's why we have to do this precise diagnosis, because all of these actually are related to having no commitment, which means mind and emotions, etc. Also earth, that it's related to the gene, and you should treat by the extraordinary vessels as well. And after that, you should make the diagnosis of the syndromes, actually the Zanfu syndromes. Okay, and if we are correct, we can expect this result. So actually, this is where we're like giving this having this hypothesis, and this is what Professor Yamamura did, and I'm testing it. So the reason of the main objective was to treat all to treat or to test it, sorry, all these hypotheses that he had. So after dealing with 40,000 patients per year, we have our own analysis. And you can use lambda point, that is where we had our posterior fontanella, okay? And you just direct the needle until the nose, point to the nose, and then all the things that you should treat with the extraordinary vessels related to the gene, you can treat by lambda point. Okay, so this is an example of the lambda point. I am just finishing, just one, like 2-3 more minutes. And she arrives with, clamping gait, pain. And this is, you just measure your hand with the hand of the patient in order to find the lambda point, okay? And actually is in the suture, is in the encounter of the parietal bones and the occipital bone. And this is only one point, and you are going to see the result. Sorry. Takes more time, to film than the result actually. And this is it, And all, especially her face, you can see that the pain, she had a pain relief with one needle. And of course, you have to treat all of them, other issues and syndromes and gene things and emotional things, etc. But you can expect this result from acupuncture. And the last is the nasal bone that Professor Yamamura, just the correspondence of the body is the muscle skeletal system in the bone, in the nasal bone, is like this. Okay, so in the middle line, you will have, you are going to have all the projection of the vertebral column, okay? So you have cervical, thoracic, lumbar, and then sacrum and coccyx in the middle, okay? And then in the lateral of the bone, actually, you are going to have the hip and the femur, and then it ends here to the toe and yes, to the toe, right? And in this anterior part of the nasal bone, you are going to have like shoulder, the projection of the shoulder, elbow, wrist, and then the hand. So this is a very easy to access. We use this a lot, especially in the hospitalized patients that you have you don't have access to every part, as we said before. So here's an example, 74 years old patient with shoulder pain. So you just seek for the projection of the shoulder in the nasal bone in the same side of the homolateral, right? The same side of the pain. And then the result is like this, is the projection. As well. Every microsystem is going to, to deliver this result for you. And that it's shoulder pain, you just seek for the correspondence of the shoulder area in the microsystem that you want to use. So it's very simple. Another thing that we can use with microsystems, she had like lumbar pain, low back pain, and of course you have also do the diagnosis of she had the bladder 32, that is the shoe point of the pelvic organs, right? You also can use these microsystems to insert the needle in the area. So bladder 32 that you should, puncture is in the sacrum, the second sacroforamen, right? So you can also use, the nasal bone or another microsystem to treat as well. Okay, or you should seek for the most painful spot here regarding to the lumbar area or the lumbar vertebrae, and then you could insert the needle there as well. Okay, and of course, since the shoe point is painful, you have to seek palpate the mole points or the line points of the pelvic organs, like stomach 25, Sanjiao-Ju, and Zygon related to the ovaries and uterus. And then if you are right, you are going to have this, right? So in the primary care, that for the non-specialist, non-acupuncturist MD, right? You can teach them, like, low back pain, just insert the needle at the lumbar area, etc. But for you, it's also very, very useful. This is another patient. She didn't have a limitation, actually, but she had pain during the movement, and you're going to see she's going to point, right? So this is, she didn't have the limitation. She could do all the movement, but she said, okay, it's painful here, here, and here. So it's in the shoulder area. And right now we are not concerned about, do you have tendinitis? Is this, triple warmer, a small intestine, etc. We are not going to deal with this like here. And I'm sorry that I didn't film, actually. This is the nasal bone. And she can easily, or more easily, do the movement, perform the movement without any pain. So this is, like very, very effective, very rapid, very fast. Okay, and the last slide is this. Okay, this is she's almost 60 something. Okay, and she came like this. She came, like walking like this, and the doctor, actually the orthopedic doctor said she should have the surgery, to fix this position. But since we know, anatomic trains or myofascial meridians, like Thomas Myers that we all know, this is related to actually muscle. I remember my dad is Professor Yamamura, and he said to me, like an orthopedic surgeon that he used to be, that actually the bone or the skeleton doesn't move itself. Who is, tract in your how can I say just moving is the muscle and the fascia and the tendons, of course. So you have to deal with this. Even if she had the surgery, she would have, pain because the muscles or all the muscle, fascia, tendon, etc., are not treated. So that's why this is not her. This is how when you have this myofascial meridian that is compromised, the patient started doing like this. Okay. So one question for you, just to end and to wake you up, how or first of all, acupuncture, is it going to have any effect on this? Yes or no? And this is her actually after one needle in the first session. And this is the beauty of acupuncture. Okay. And now, of course, after the session, because she came 1 week later, so she does weekly sessions. And of course, the muscle and all the position, all her structure, it has memory. So you have also provides neuroplasticity as well. And then when she came, of course, she get back a little bit, and was on the second. Okay, she still has this angle, but it's not like before. Okay, so this is a very good result. We have all of this in our book in Yamamura microsystem, and I hope to actually I apply for it to perform a workshop in our next Congress in Istanbul. So I hope to meet you there in November. Please follow us in Instagram. We have our account that is Medical Acupuncture Council. Just please follow us. And every year, each organizer of the Congress has their own Instagram account that is March 2026 this year. Okay. And this is my Instagram. I'm sorry if I was too late at the time. I hope to see you
No,
every
you were on
every one
time.
of you there. Thank you. Thank you very much. Thank you, Constantina, for inviting me again.